I am Sridharan of Kasaragod native. I have come here for my mother. She had a complaint of jaundice. So we tested her urine from nearby hospital in Kerala. Then it was detected the jaundice was there. Then after that her blood was tested and the jaundice, severe jaundice was detected. Then the doctor from that hospital suggested us to admit her near the another hospital because at this age there is no chance of jaundice. So she will have some complaint of he was suspecting some complaint in the liver. Then we admitted her in Payanur hospital. Then one doctor asked us to do the ultrasound scanning. From the ultrasound scanning, it was detected a block from the liver to the small intestine. Then the doctor from that hospital suggested us to do some more investigation, just like a triple phase CT. Since a triple phase CT facility was not available in that hospital, we have to go another hospital. They suggested you can admit her in another hospital where these facilities are available. Then we asked them to admit there because it was late evening. We admitted her there. And the next day we asked, because that surgeon asked us, because my mother is 87 years old, so it is not possible to do an open surgery. Then the doctor suggested PTBD is the only process we can adopt for those who are not able to do this open surgery. Then we were planning to go to Kozhikode. There is a hospital Kozhikode. Then again I was searching for where these facilities are available, where this doctor, interventional radiologist is required to do this, and a gastroenterologist should be involved in this process. And then we got the name of the Indiana hospital. This is my first case. I was coming first time here. And then immediately I sent all these informations, this PTBD process and the interventional radiologist, gastroenterologist, all this information. I informed, getting the telephone number of the Indian hospital, I informed to one person here, and she understood everything, and they asked me to send all the details by this WhatsApp also. Then after some time, maybe after 1 hour, they told me that all facilities are available here. You just immediately come over here. Then we discharged from that hospital and we reached here by 4:15 on 14th of this month evening, for around 4:15 we reached here. As soon as we reached here in ambulance, the one doctor Apoorva, is a famous doctor. I came to know later on only he is a very famous doctor, and Dr. Apoorva was standing there waiting us, just like waiting as us. Then he asked the assistants to take her immediately to the emergency department. Then after that he has done some just checking, but then after that he explained to me what we can do. He told me that he need to do some more detailed investigation, just like CT scanning and MRI scanning. And without losing time, he immediately suggested them to do the CT scanning. And after CT scanning and after this MRI scanning, he explained to me that there is a block in the liver itself. There is a growth in the liver itself, just like a tumor like growth. So he told me that as the earlier doctor told, surgery is not at all possible for her because she is very weak, and if she was below 65 years, we could have done like that, he told me. Then after that, he explained to me by drawing what is liver and what is liver bladder and what is everything in detail. I never got such an experience from anywhere. And what is small intestine? What is the bile? Bile means the pitta rasa in Malayalam. What is the function of this bile? With the food, because it is mixing with the food in the small intestine. Then that is why the digestion is happening. All these details he explained to me, and he told me that we admitted here, and immediately we admitted here and reached here. Next day, one interventional radiologist from AJ Hospital, Dr. Ashwin, came here and he checked my mother, and checking all the details he obtained from the MRI and this CT scan. He also explained to me in detail what he is going to do, what is possible for her. Then he told me that PTBD is the only process. He explained to me what is PTBD. One stent will be placing inside through this block. Through this block, one stent tube will be placing, metallic tube will be placing, and after that, from that tube there will be connections. For temporary connections will be there to the outside one tube, so to collect the bile. Then for one, the surgery was done in the evening. It took around 3.5 hours. Very cautiously, he told me that maybe one stent will be enough. But since the other side biles are not collecting to the one stent, he placed one more stent also. Then after that, after the surgery, he called me in his room, and me in his room, and he explained showing the video. He explained what is stent, how this is coming, how this placed, and everything. We were afraid because whether it is possible for my mother, and because everything was proper and without losing time. Then after that, after next day, he again checked and he called us, and he removed the tube which is placed outside. Then after that, he gave these drips as usual, and that drips we could see in the video that drips were coming very properly, and he told me, he explained to me that this is working properly and both stents are working properly, and that is why I removed this tube. So everything was proper, and our route was also proper. Otherwise, we would have go in somewhere else, and the treatment was different. And we got correct, proper guidance, proper explanation, and everything. And my experience in the room also, the 3 times cleaning is there. I call my friends every day. I am here over phone. I am calling my friends and telling all this experience. I never got in any hospital. I have gone many hospitals. I never got such an experience. Cleaning is 3 times, and doctor coming at correct time, and nurses are coming in proper time and giving, and every time, even in night and every time, their service, the doctor's service, and nurse service, and the service of all other personnel are very, very correct and very, very, very satisfactory, very, very much exemplary. Let me again tell, exemplary. It is an exemplary. I will not name any hospital, but my experience in Kerala is different. Here, my experience is very different and very satisfactory. And particularly the Dr. Apoorva doctor. First, we consulted the Apoorva doctor in the emergency. He only directed everything. And after that, the Dr. Ashwin, interventional radiologist, both the doctors were very, very clear, and we don't have any doubt. We didn't have any doubt while they were explaining. And now mother is getting, and maybe tomorrow we will be discharging from here. And this experience is very exemplary, and the services of all personnel here, and the cleaning and the canteen food, I never said like this to my relatives and my friends, and after hearing this, lot of patients are planning to come over here, and they are asking which doctor is good for this ortho, which doctor is good for physiotherapy, and they are asking, and I have already collected the details of the doctors, and I will be sharing to them, and in future also, because my experience is very, very, very different. So this experience I will be sharing to my friends who are willing to come over here, who want to get a good treatment. So this is very, very good. And thanks, and I don't know whether I explained everything. Thanks to the Indiana Hospital, and thanks to the doctors, thanks to the sisters, and thanks to all personnel who served for us and who served for my mother. And my mother, I think it is okay, and she is okay, and maybe we will be going tomorrow to my home. We never forget this Indiana Hospital.
Indiana Hospital and Heart Institute. Aid. Inspire. Aspire.